Here's the first patient where we documented that this disease too can largely be gone one day. 51-year-old businessman. This is a ultra-fast CT, which is does the X-rays fast enough to avoid the blurring effect that you normally would have when the heart beats. So you know, under a normal X-ray, you can't measure the calcification in the coronary arteries because of the pumping heart. But this machine is so quick that you can measure those calcifications in the coronary arteries. So what you see here is, this would be the heart, a very big one. So this is a magnified picture. It's a slice of the heart. You look inside the heart from the bottom. So this is the left side of the heart, and this white spot here, well, this is the left coronary artery cross-section, and then this white spot here is the calcification. 1 year later, same patient, same heart, same left coronary artery, and the deposits are gone. What happened? Was there some angioplasty or some bypass surgery? Of course not. What this person did, he filled up the cells that make up his blood vessel wall with the micronutrients that were deficient in these cells. Of course, he didn't put it in these cells like that. He was taking the micronutrients, and they found their way automatically there. So what happened is that the supply of optimum micronutrients replenished the cells that made up the blood vessel walls. The cracks and crevices closed. The debris was naturally pushed out. And this is what you see here. We stimulated the cells to think anew. What is your job? What do you have to do? Produce enough collagen. So here's the answer to the riddle of why people do get heart attacks and not nose attacks. What sets the organ heart apart from all other organs in the body? It pumps, it moves. The liver doesn't pump, the brain doesn't move. So it pumps. On top of the heart are the coronary arteries. They're riding on top. So with every heartbeat, the following happens. I've magnified this in this picture here. This is the coronary artery cross-section here. During the filling phase of the heart muscle is relaxed. And the coronary artery riding on top is open. During the pumping phase of the heart, when the blood is thrown out into the aorta, the heart muscle is tense, and the coronary artery on top is squeezed flat. And that happens 100,000 times a day normally. That's the pulse, number of pulse beats or number of heartbeats per day in your body. Well, let's compare this to a garden hose in your garden. If the garden hose is new, elastic, you can step on this garden hose 100,000 times a day. Nothing will happen. If it's brittle, if it has been in the sun too long, lost its elasticity, that's the spot where you will see the cracks and crevices develop, where you step on. That's the explanation why we get heart attacks and not nose attacks. Because the heart moves. Because the moving heart is exposing the underlying instability of the blood vessel walls as the primary location. What that also tells you is that if your doctor wants to prescribe you cholesterol-lowering drugs, you may smile and say, "Thank you. I would like first to stabilize my blood vessel wall by taking an optimum amount of vitamin C from the health food store." He may not like this answer, but then you can tell him this picture and ask him, "What is your explanation?" He won't have an answer. Or this one. 99.9% of the animals on our planet produce their own vitamin C. By doing that, they have sufficient amount to stabilize, produce enough collagen, stabilize the blood vessel walls. They don't develop heart attacks. Our ancestors have lost the ability for what we call endogenous production of vitamin C, which means production of vitamin C in our liver. And we are dependent on every milligram of vitamin C that we get in our nutrition. The most interesting animals among them are the hibernating animals, like the bear. Before they hibernate, they eat a lot. So bears have cholesterol levels of up to 600 milligrams per deciliter and more. Now, if the cholesterol-lowering drug manufacturers would be right, these guys would long be extinct from an epidemic of heart attacks because they get too little cholesterol-lowering drugs. But the answer is much simpler. If you protect your blood vessel walls, if they are elastic and stable, you can tolerate elevated cholesterol levels and triglyceride levels. I'm not saying you should ignore them. Healthy lifestyle, exercise, prudent nutrition. What I'm saying is be careful with cholesterol-lowering drugs. They have severe long-term side effects. Heart failure. These are the patients that have difficulties to breathe. When they walk staircases, they have to stand after the first floor, on the first floor and the second floor, etc. Edema in the legs. The heart of a heart failure patient pumps like that, when it normally pumps like that. Instead of about 1 teacup of blood thrown out by a normal heart pumping mechanism, maybe half of a teacup of blood is being thrown out into the aorta in a heart failure patient's heart. What's the reason for that? What do you think? Well, it's really not so difficult. The function of the heart in the body is like the motor in your car. It's the engine. It constantly moves and has the highest workload of all organs. So where do you fill your gasoline in your car? You need gasoline for your windscreen wiper or for your glove department? Of course not. You make sure that your engine has enough energy. It's really not so difficult. Sometimes I say, when you attend a lecture of this nature, you go through 2 semesters of medicine without paying for it. It's so logical. So bringing bioenergy to the heart muscle cells will help them to do their job. The engine will drive on 4 cylinders instead of 2 or 3 cylinders.